night. All righty then. So let's start off, since we're going to be, last video, we identified the muscles of the upper extremity. Now I want to kind of get into some of their actions and some other specifics about them. So we're going to start off with the muscles that are going to be moving the pectoral girdle. And if you recall, the pectoral girdle involves the clavicle and the scapula. So let's start off with the muscles on the front. And there's a couple that you notice here, the Pectoralis minor, serratus anterior, and subclavius. Now, only one of these muscles you're responsible for lab, but we're still going to talk about the other ones because you should still know this stuff. Pectoralis minor is going to be, all right, the smaller of the pec muscles. Okay, you got pectoralis minor and pectoralis major. So pectoralis minor is deep to pectoralis major. And this muscle is largely responsible for people that present with hunched shoulders. The shoulders are drawn forward. A lot of folks that work at computers all day long, again, I'm not trying to shame anybody, but if you're on your cell phone a lot, if you're doing a lot of stuff on a tablet, okay, you're constantly working in front of yourself, well, that has a tendency, you're going to utilize this muscle quite a bit, and so it's going to help to pull your shoulders forward. Also, in addition to the hunching of the shoulders, right, it is going to depress, okay, that's going to cause your scapula to go down inferiorly, and it's going to also protract the scapula, which is basically, when we talk about protraction and retraction, protraction is for the scapula is pulling the scapula away from the vertebra, okay, out towards the sides. Retraction is like trying to pinch your shoulder blades together. All right, so the next muscle, serratus anterior, we saw that before. That's that muscle that sits underneath your armpit. It's a fan-shaped muscle. The serratus part is the way we describe that muscle because it looks like a serrated edge, something like that. And that's because it interdigitates in between the ribs. And then it'll attach, its other attachment site is on the scapula itself. It actually will travel underneath and in front of the anterior surface of the scapula and attaches onto the medial border of the scapula. And so when we say that it stabilizes the scapula, it literally helps to keep the scapula flat against your back. If you damage the nerve called the long thoracic nerve that innervates this muscle, which is commonly, I shouldn't say commonly happen, but it has a tendency to happen in women if they undergo a mastectomy or if they undergo some removal of the lymph nodes. If the physician isn't careful when they're doing those procedures, they can nick or damage this nerve, and what that will do is that will cause the medial border there on the scapula to kind of pop off of your back. Doesn't like literally pop off, but you can see that protrude underneath the skin quite a bit. In addition to stabilizing the scapula, this muscle too will also protract the scapula, kind of pull it away from the spine. Subclavius is a muscle that you will find, all right, between the clavicle and the first rib. Right, it also will help to stabilize and depress the scapula. So here you can see, here is Pec Minor, right, attaches onto the coracoid process and ribs 3 through 5. Right, so you can see how when this muscle shortens, it'll pull your shoulders forward. In subclavius, you can see it here attaching onto our first rib and the clavicle. And then down here, you can see the serrated edge here of serratus anterior. All right, the muscles on the back, levator scapula, rhomboid major and minor, and trapezius. Now, if we look at levator scapula, this is one of those muscles I was telling you folks about, and the name of the muscle kind of tells you what it does. So it attaches on the superior angle of the scapula. So here's your spine, here's your scapula. It attaches onto this corner here, and it heads up towards the cervical spine. upper vertebrae in the cervical spine. So, all right, the name implies that it's going to elevate, that's going to raise the scapular upwards, and it causes inferior rotation of the scapula, which basically says that it is going to swing the scapula inwards there. Then we have rhomboid major and minor. These muscles we saw before, they are found in between your vertebral spine and the medial border of the scapula. And so these muscles, when they contract, they'll pull your scapula toward your spine. So we call that retraction. All right, they'll also help to elevate the scapula, pull them upwards. And then again, we'll also see some inferior rotation of the scapula. One of my favorite muscles, trapezius, this is the most superficial muscle that sits on the back. It's a big diamond-shaped muscle. It's a trapezoid, so it pretty much looks like a diamond here. And it attaches, it starts at the base of the skull, and it goes all the way down onto T12. Big muscle. And it goes out to the shoulders here. So depending on which fibers that you're exciting, if you're exciting the upper fibers, you're going to elevate the scapula. All right. If you're exciting the lower fibers down here, you're going to depress the scapula. And if you're contracting the middle fibers in between the shoulder blades, you'll retract the scapula. And depending again on which fibers that you're contracting, it will cause rotation, either inferior rotation or superior rotation of the scapula. Okay, so you can see here is trapezius, nice superficial muscle. You have your upper, middle, and inferior fibers. And then we have our levator scapula muscle here. And when we contract that, it swings the bottom part of the scapula inwards. And then our rhomboids here will pull the scapula towards the spine, also help to elevate it. All right, so let's talk now about our shoulder joints. You have a couple different shoulder joints now. Right? You get the glenohumeral joint, that's the main shoulder joint there, the most mobile joint in the body, but also the most unstable joint. You have your acromioclavicular joint, and then we also have our sternoclavicular joint. But for the most part, all right, from this point on, we're going to be mainly referring to the glenohumeral joint and the arm. If you recall, when we're discussing the arm, when we're talking about the upper extremity, the arm is going to be that portion of your upper extremity in between your shoulder and your elbow. So let's talk about what muscles do what to our glenohumeral joint. And we're going to discuss the prime movers. These are the big ones. All right, so the first one is Latissimus Dorsi muscle. This is that muscle I was describing to you before that's well developed in swimmers, especially if they do the butterfly, folks that do a lot of pull-ups, in rowers. Right? So it's this big muscle, right, located in the middle portion of your back. And its prime movement is going to be extension of the glenohumeral joint. What does that mean? If your arms are down to your sides and someone's going to jump on your back and you don't want them to, you move your arms backwards. Okay? So that's the prime movement of the latissimus dorsi is going to be, all right, arm extension, moving your arms back. But also we'll see adduction. And if you don't remember what adduction is, it's when you bring, all right, the muscle will bring, for example, your upper extremity. If your arms are out to your sides, like if I ask you to do arm circles, we probably remember having to do that in gym class. Okay, do arm circles. When I say, okay, all right, bring your arms back down to your sides, that's adduction. So that's what latissimus dorsi does. Also, it will undergo medial rotation. And if you don't remember what that is, if you're standing in the anatomical position, that your palms are facing anterior, facing forward, if I tell you to turn your palms posteriorly, right, face them backwards. When you do that, when you rotate your shoulders, that's going to be medial rotation. Okay, medial rotation. Pectoralis major, that's that big chest muscle that sits on the upper ribs there, ribs 3 through 7, 7, 8. All right. Again, it is another fan-shaped muscle. All right. Its prime movement is flexion. Easy. Shoulder flexion is basically if I'm running full steam at you and you don't want me to run into you, what do? You put your arms out in front of you. Okay, so when you bring your arms up, that is flexion. We'll also see it adduct and medial rotate the arm, similar to latissimus dorsi. And it's interesting because latissimus dorsi and pec major, right, attach onto the humerus very close to one another. And you'll see that muscles that are in generally the same area, or if they connect to the same area, right, there's an attachment site of these muscles that are close by. They'll usually have similar, I won't say the same, but they'll have similar actions. All right, this one, all right, the actions that are similar between latissimus dorsi and pectoralis major are going to be adduction and medial rotation of the arm. All right, triceps brachii, biceps brachii, deltoid. These muscles, when we're referring to their actions on the glenohumeral joint, on your shoulder joint, right, the triceps brachii sits on the posterior portion of your humerus, on the backside. So it's going to help to extend. That's if I'm trying to jump on your back and you bring your arms backwards, you don't want me to, that's extension. And it'll also help to adduct the arm. Biceps brachii. Now, again, when we're talking about the names of these muscles, triceps, that's telling me how many heads. I've got 3 heads. Biceps is telling me that I have 2 heads. Brachii is telling me where the location of these muscles are on the brachium. All right, so biceps, there's 2 heads. It is going to flex the arm. So I'm running full steam at you. You put your arms up to keep me from hitting you. That's flexion. Deltoid. Okay. Prime abductor of your shoulder. Now we'll talk about another abductor of the shoulder, but the deltoid is a prime abductor of the arm. Remember abduction, when you abduct somebody, you take them away. So when we're undergoing abduction, okay, we bring our arms away from our body out to our sides, away from the midline there. So the deltoid muscle is a triangular shaped muscle. And so there's 3 parts to it. All right, this is the anterior, and this is the posterior over here. Okay, there's 3 parts to it. You have the posterior fibers, you have the anterior fibers, and then in the middle, you have the middle, or you'll have the lateral fibers. The anterior fibers, all of them are going to contribute to abduction. All right, but the anterior fibers are going to flex and medially rotate the arm. The posterior fibers are going to extend and laterally rotate the arm. That means if you're standing in the in the anatomical position and your palms are facing forward, if you start to turn your palms out away from your body, all right, that's lateral rotation. You're going to be rotating, moving your thumbs out. And then the lateral fibers or the medial fibers are going to abduct the arm. All right, coracobrachialis, teres major, and then we'll get into the rotator cuff muscles here in a moment. But the coracobrachialis muscle is found on the anterior portion of your humerus. It's going to flex and also adduct the arm. And then teres major is going to extend, adduct, and medially rotate. So the rotator cuff muscles, those are fun muscles. You know why? Because they help to keep your arm from falling apart, or I shouldn't say your arm, your shoulder. All right, it's the rotator cuff muscles that actually provide quite a bit of stability to the glenohumeral joint. And so when we learn about the rotator cuff muscles, we learn about the acronym called SITS. Whoops, went there. I went there. All right, SITS. You know me, I don't like to use a lot of acronyms. There's 4 muscles that are part of the rotator cuff muscles. All right, the first one is going to be the subscapularis. All right, the next one is going to be infraspinatus. The next one is going to be teres minor. And then our last one is going to be supraspinatus. Sits. Okay, subscapularis, infraspinatus, teres minor, and supraspinatus. Now, subscapularis sits on the anterior surface of your scapula in the front. It's sandwiched in between the actual bone of the scapula and the ribs. So its prime job is going to be medially rotate the arm. Another way to look at medial rotation is if your arms are down to your sides and your palms are against your legs. If I say to you, okay, do me a favor, bend your elbow at 90 degrees. So now your arms are bent at 90 degrees, right? And your fist, if you make a fist, your fists are going to be pointing straight out in front of you. Now, if I say to you, okay, what I want you to do is I want you to bring your hand or fist to your chest. Okay, so when you turn and rotate your arm inwards, that's medial rotation. If I say, okay, now bring your arm back to that position that I originally had you in, all right, with your elbows flexed, when you go back to that position, that's lateral rotation. Right? Supraspinatus is an abductor of the arm. And in fact, the first 15 degrees of abduction of your shoulder is primarily supraspinatus. Deltoid muscle takes over and will continue on and bring your arm up, if you're abducting the arm, up to about 100, 120, 130 degrees. Because if I tell you, all right, listen, I want you to have your arms to your side, and then I want you to keep raising your arms away from your body and try to bring your arm up against your ear. When you get past about 120 and 130 degrees, all right, deltoid can only do so much, but the trapezius muscle starts to take over and help out too. So it'll help with a little bit of abduction of the arm near the end range of abduction. All right, the last two muscles of our rotator cuff are the infraspinatus and the teres minor. Again, they're in a very close proximity to one another. In fact, infraspinatus is superior to teres minor. So they're pretty much going to have the same actions, adduction and lateral rotation for the arm. And so when we see these muscles, you'll see what I'm talking about, and that how they have very similar movements. Okay. So we're now going to move down into the actual arm area, all right, where the humerus is. So we talked about the shoulder here, the glenohumeral joint, and what muscles do what with the glenohumeral joint. Now we're going to go and move down into the upper portion of your upper extremity, the arm, and then we'll talk about the forearm, and then we'll talk about the hands here. All right. So when we are talking about our extremities, our limbs, we actually organize the limbs into compartments. And it's the deep fascia, which is connective tissue, which is going to separate, all right, our muscles into these compartments. Now, if you're interested in sports medicine, knowing these compartments will be very helpful for you, because there is a condition, it's called compartment syndrome. And you'll see it more so, in my experience, it's been more in the lower extremity than in the upper extremity, in which somebody can sustain a trauma to one of these compartments. And if it ruptures a blood vessel, especially if it's an artery or whatnot, blood starts spilling out into this compartment, it starts to fill the compartment up. And so blood will start to compress tissues in that area. And that can include nerves, the muscles, whatever else, God forbid, if we're in the extremity, so you won't really have any visceral organs, but you'll have these muscles there. Well, that can cause damage to these tissues here. So it's helpful to kind of know these compartments, especially if you're going to be doing some sports medicine. I can't remember. I think it was Grey's Anatomy when I used to watch the show. This is years ago. And I want to say there was an episode in which some of the doctors were in a plane crash, and one of them actually had damage to their leg, I believe, and one of the other doctors had to cut them open to release the blood that was filling up the compartment there. Anyways, so when we're talking about the upper extremities, the limbs, right, you have two compartments. You have the anterior compartment and the posterior compartment. The nice thing about these compartments is that the muscles in these compartments share similar functions and movements. Right, so the anterior compartment muscles are going to be pretty much muscles that flex the arm there. And then the posterior muscles are going to extend. And so this is going to have to do with the elbow joint. What's happening at the elbow joint? So when I say, the anterior compartments of the arm flex the muscles, that means it bends the elbow. Posterior compartment muscles are going to extend the forearm. That means it's going to straighten your elbow out. So the muscles in the anterior compartment are supplied by the deep brachial artery. That is a branch off of the brachial artery. And it's innervated by the musculocutaneous nerve. And that nerve comes off of, it's predominantly C5. Right? You probably don't know what C5 is. No problem. We'll learn about that later on. The posterior compartment is also supplied by the deep brachial artery, but it's innervated by a different nerve, the radial nerve, and that's predominantly going to be C7. So let's roll through some of these muscles of the anterior compartment. The biceps brachii. This is that two-headed muscle there. And so it is going to flex, and if you recall what supination is, it's going to supinate the forearm because this muscle attaches onto the radius. And it's the radius when we undergo supination where the radius, normally the ulna and the radius are parallel to one another. But when you undergo supination, the radius will cross over the ulna. And so the biceps brachii helps with that supination there. Okay. Brachialis, this is important. When we're talking about bending the elbow, this is the muscle that is the most powerful elbow flexor. It's going to be found in between, all right, the biceps brachii and the triceps brachii, deep to the biceps brachii. Another muscle which we're going to actually see not in the brachium, but actually in the forearm. So how do we find out where this muscle is? All right. Your arms are down to your side. I ask you to bend and flex your elbow at 90 degrees with your right arm. Okay. And I want you to make a fist, and I want your fist to be pointing straight forward. So your thumb will be superior and your pinky will be inferior. And so you take your left hand and put it on top of your forearm. And then I want you to try to flex your elbow more, but resist yourself so that you undergo an isometric contraction. You don't have any movement. You'll feel a muscle on the top of your forearm. That's the brachioradialis muscle, right? It's going to be on the anterior lateral portion. It does help with elbow flexion. In joking, when I was in med school, we used to call it the beer drinking muscle, because when you actually are holding a glass of water or whatever, or Gatorade, and you're bringing it to your mouth, right, this muscle helps with that. Okay, so here you can see some of the superficial muscles here in the anterior compartment of your arm. So biceps brachii, you've got two heads, right? The long head, I remember, is lateral, so it's long. So that's the tendon here you can see traveling up in between the intertubercular groove, and it attaches onto and fuses into the glenohumeral capsule there. And then the short head is going to attach onto the coracoid process right up here. Then deep to that, you're going to have brachialis. That's the powerful elbow flexor. And then you're going to have coracobrachialis. Right? That is going to help with flexion of the glenohumeral joint. All right, let's go on the back side, the posterior compartment. Two muscles that we're going to talk about are triceps brachii and coneus. Right? Triceps brachii is going to be pretty much the prime extensor of the forearm. Also does some extension of the glenohumeral joint, but primarily of the forearm. Okay, triceps, 3 heads. You have a long head, a short head, and a lateral head. And that's going to be found on the backside of your humerus. Anconius, it's a weak elbow flexor. I'll show you this when we go through the identification portion, but it is going to be, all right, on the posterior portion on the outside or lateral portion of your elbow. All right, so here's the triceps brachii. You can see all the different heads there, but it's on the backside of your humerus there. Nice little view of Latissimus Dorsi. Then you can see, well, it's tough to see, but Anconius, there it is. There's Anconius. Really small. I got a better picture of that for you in, my brain's not working. I got a better picture of that in the identification area. Then you can see a couple of our rotator cuff muscles here. Okay, here's the spine of the scapula. So above the spine of the scapula is supraspinatus. Below the spine of the scapula is infraspinatus, and then right below that, inferior to that, is teres minor. All right, let's gravitate now down into our forearm. And so we're going to talk about some of the muscles of the forearm. Now, keep in mind, our forearm, right, is going to have compartments also. I'll talk about that in a moment. All right, but we have a couple muscles here, right? Since we're talking about the elbow joint, let's stay on that subject here. We've got a couple muscles that are going to affect movement at the elbow joint. All right, we've got the pronator muscle group and then the supinator muscle. All right, so pronator teres and pronator quadratus, obviously, their job is going to be, it says it right in the name, to pronate the forearm. All right, so when we're talking about pronation, remember what I said, if you bring your hands together and drink some water, okay, out of a stream or whatever, that's called supination. All right, so in the anatomical position, right, your arms are in the supinated position. Your ulna and your and the radius are parallel to one another. Your palms are facing forward. When I say to you, okay, now turn your palms so they're facing backwards, that's pronation. So that's what we're going to see with pronator teres and pronator quadratus. They're going to rotate the radius on top of the ulna so they'll no longer be parallel to one another. So they are in the anterior compartment of the forearm. You have an anterior and a posterior compartment. Supinator, okay, is going to be found in the posterior compartment. I don't think I need to tell you what supinator does, all right? That's a simple muscle that was named for actually what it does. So here's our pronator quadratus. It's at the distal end of your forearm, and then our pronator teres, all right, which is on the proximal portion of the forearm. And you can see how those muscles will pronate the forearm. And then here on the lateral portion is the supinator muscle. All right, lateral epicondylitis, otherwise known as tennis elbow. I don't know if any of you have ever had this. Anytime you talk about any type of itis, right? Itis is an irritation to something, okay? So conjunctivitis is an irritation to the conjunctiva of your eye, right? Lateral epicondylitis is going to be an irritation to the common extensor tendon in your forearm. And so it's a form of a strain injury, okay? So if you've ever had lateral epicondylitis, we refer to that as tennis elbow, but if you've ever had medial epicondylitis, we call that golfer's elbow, right? So what we usually see in this type of condition, all right, it's either going to be caused from some sort of trauma or overuse. If your job, I see it quite a bit from patients of mine that work at BMW, if they're on the production line, and if they keep doing the same job, like screwing something onto a car all day long for 8 to 10 hours, that's an overuse injury. So in this case, that will irritate that common extensor tendon. And so what the patient will complain of is pain and tenderness over the lateral epicondyle, because that's where these muscles attach onto that common tendon there. So a lot of times what we'll say is, okay, rest is the best way to do it. You need to stop, these repetitive motions, and you can do steroid injections, physical therapy. In some cases, surgery may be required, all right? But always start with the easiest, cheapest, least invasive, and that's just to rest it. All right, so let's jump down here into the forearm and talk about the muscles that are found in the forearm and how they affect your wrist, your hand, and your fingers here. So like I said before, we have two compartments, an anterior compartment and a posterior compartment. For the most part, the muscles that are in the anterior compartment are going to cause flexion at the wrist. We'll see where some of those muscles will cause flexion at the interphalangeal joint. What's that? All right. The interphalangeal joint is going to be, all right, a joint that is created between your phalanges. So if you recall, some of your digits have 3 phalanges, and some of your digits, only one actually, has 2 phalanges. So the thumb has 1 interphalangeal joint because it has a proximal phalanx and a distal phalanx. Now digits 2 through 5, since there's 3 phalanges, it'll have 2, those digits will have 2 interphalangeal joints. And so the interphalangeal joint closest to the tip of your finger, all right, that's the joint between the middle and the distal phalanges, that's called the distal interphalangeal joint, also known as the dip joint. And then the joint in between your proximal and middle phalange is known as your proximal interphalangeal joint, also known as the pip joint. You'll see what I'm talking about here in a little bit. All right. So for the anterior compartment muscles, most of those muscles will come off of the medial epicondyle. So these muscles can contribute to that golfer's elbow I was telling you about. The posterior compartment muscles found on the backside of your forearm pretty much are going to extend the wrist. But what we will also see is some extension between the metacarpal phalangeal joints. That's that joint between the metacarpals, that's the palm of your hand, and your proximal phalange. And we'll also see how they'll cause some extension at the interphalangeal joints. And that will include your dips and pips. All right. So these, all right, muscles pretty much will come off of the lateral epicondyle. Not all of them, but most of them. So they'll contribute to that tennis elbow. So have you ever wondered why, okay, and this applies more to the lower extremity, how our tendons, right, don't just come popping off the bone, right? Not like that where they attach. They should definitely be attached. But in some cases, in order to do some of these movements, our tendons have to be really close and run parallel to some of the long bones. So we have a tissue, right, that helps to hold our tendons close to the bone. And we call that the retinaculum. And it's this dense connective tissue, right, that helps, all right, to keep our tendons close to these bones. And we'll see it here in the upper extremity around the wrist. Right? And so the deep fascia will shoot off these broad, flat bands that hold the tissues, all right, the tendons close to the bone. So when you contract, it doesn't alter the movement of these tissues here. So you have what's called the flexor retinaculum and the extensor retinaculum. The flexor is going to be found on the anterior palmar surface along the carpal bones there. And if you've heard of the carpal tunnel, so this flexor retinaculum sits on top of that carpal tunnel. So now you have to understand something about the carpal tunnel. The carpal tunnel has 9 tendons and 1 nerve, and it fits in this really small, tight space. And so the flexor retinaculum then sits on top of that. So if anyone's ever had carpal tunnel and had to go in and get surgery, this is the tissue that they cut. They call it a carpal tunnel release surgery. And so they'll cut into this flexor retinaculum, it makes the carpal tunnel a little bit more unstable, unfortunately, but it does relieve some of that space there. So it allows some of those flexor tendons and that nerve there a little bit more room. Then on the back side, right, of your wrist, on the dorsal surface there is the extensor retinaculum. And so again, we'll see some of the extensor tendons, all right, of the wrist and some of the digits that will pass underneath that. All right, so anterior compartment. There are 3 layers. You have a superficial layer, an intermediate layer, and a deep layer. Let's start with the superficial layer. All right, these muscles will attach onto the medial epicondyle. Ooh, that's a great question, Rachel. It depends. Really, it depends on what caused the carpal tunnel. If it's job related, if you quit your job, there is a possibility that the symptoms may resolve themselves if you do a completely different thing. All right. In some cases, if it gets bad enough, surgery is usually an intervention. A lot of people, we try to keep them out of surgery. Not to say that surgery is not an option, but I always say make surgery the last option if you can. Physical therapy can help sometimes. Sometimes people will sleep with braces on their wrists. It helps to keep their wrist in a cocked neutral position, right? And you can put bands around your wrist, which will help to loosen up that space there where the carpal tunnel is. So it really depends on how progressed it is. Sometimes you can go in and get an injection with steroids, and that will help. It's like putting a Band-Aid on the problem. And so if you keep doing if your job is causing this and you keep working the same job and you go in and get a steroid injection, the steroid injection will help for a little while, but then eventually that will wear off, and then the symptoms will come back. So again, it really depends on the progression of it. Okay, great question though, great question. So the superficial layer. In the superficial layer, we have these muscles, the flexor carpi radialis, the palmaris longus, and the flexor carpi ulnaris. Now, if you look at the names for some of these, it tells you the action of the muscle. And then it also is going to tell you if it's on the radial side of your forearm or if it's on the ulnar side of your forearm. So the flexor carpi radialis, all right, this muscle is going to flex the wrist. And it's going to be found on the radial side of your forearm, which is the lateral portion of your forearm. And so it will abduct the hand. So what does that mean? So abduction of the hand. Come on, where is it? I'm going to try this. I didn't do this last class. Hello, hello. All right, so look at my wrist here. Okay, here's my hand. If flexion of the wrist is this, I'll go off to the side. There's flexion. Here's extension. Okay. Now, when we talk about abduction of the hand and adduction of the hand, when we abduct, okay. Now think of me. I'll show you. Think of me here's the anatomical position. I'm in the anatomical position. So if I ask you to abduct your hand, you're going to do this. At my wrist, I'm just bringing my wrist away from my body. If I ask you to adduct, A-D-D, adduct, I do this. Like that. Okay? So that's what I mean by abduction and adduction. That wasn't so bad, right? Okay. Go away. Okay. So let's now make that disappear. Okay, so flexor carpi radialis flexes the wrist, abducts the hand. Flexor carpi ulnaris, again, will flex the wrist. It's on the ulnar side of your forearm, so it will adduct the hand. And then palmaris longus is kind of in the middle, thin muscle. Right? And so it is going to help with some wrist flexion. It's kind of a weak wrist flexor. But I tell you, if you want to see the tendon for the palmaris longus muscle, all you have to do is try to bring your thumb and pinky together. That's called opposition, and then flex your wrist, and you'll feel a tendon right there in your wrist, and that's the palmaris longus tendon. All right, so in the intermediate layer, that's the deeper layer. Okay, again, attaches onto the medial epicondyle. we have a muscle called the flexor digitorum superficialis. So this muscle tells you exactly what it does. It flexes the digits. So when we're dealing with digits 2 through 5, all right, this tendon, or these tendons, because they're individual, all right, will attach to the distal portion of the middle phalanges. So that means that this muscle is going to flex the proximal joints to the distal, to the middle phalange. So that means, all right, the proximal joint, all right, to the middle phalange is going to be your proximal interphalangeal joints, your metacarpal phalangeal joints, and the carpal joints, the wrist bones. So that's why when we say our flexor digitorum superficialis here is going to flex the wrist, it's also going to flex the metacarpal phalangeal joint. That's where the metacarpal and the proximal phalange articulate with one another. And then the proximal interphalangeal joints, also known as the pips, right, that will be the joint that's found in between your proximal phalange and your middle phalange, your first knuckle. Okay, whether or not you consider the metacarpal heads to be knuckles also. All right, then their deep layer on the anterior compartment is going to house the flexor pollicis longus and the flexor digitorum profundus. Right, so flexor pollicis longus, if you look at the name, flexor and pollicis have to do with the thumb. So this muscle attaches onto the distal phalanx. So again, it's going to flex the proximal joint. That includes the metacarpal phalangeal joint, and since there's only one interphalangeal joint, because you only have two phalanges in the thumb, right, it will flex the interphalangeal joint of the thumb. It will offer some flexion at the wrist, but not a lot. And then the other muscle is the flexor digitorum profundus. Profundus is deep. Superficialis is going to be more superficial. So this muscle is going to lie underneath or deep to flexor digitorum superficialis. Same type of scenario. It has 4 tendons that are going to attach onto digits 2 through 5, except these tendons are going to attach to distally on the distal phalanges. And so they'll flex all the joints that are proximal to that. So that's going to include flexion of the wrist joint, flexion of the metacarpal phalangeal joints, flexion of the proximal interphalangeal joints, which are pips, and flexion of the distal interphalangeal joints are dips. So here you can see some of these muscles here. Okay, so on the anterior compartment, here's our pronator teres, we already saw that. And then going more medial to that on our forearm, we've got our flexor carpi radialis. You can see it's going over to the radial side. Here's the thumb, that's where the radius is. And then next to that, we've got palmaris longus. Palmaris longus muscle, you can see the tendon going right towards the palm of the hand. And then we have flexor carpi, I can't talk tonight, flexor carpi ulnaris going to the ulnar side of the forearm there. And then you can see that aponeurosis there. Here's the flexor retinaculum. It's like this band here that helps to keep these tendons close to the bone so they're not popping off the bone. All right, here we can see some of the deeper views. Here's the intermediate layer. There's only one muscle in the intermediate layer, the flexor digitorum superficialis, and then it has its 4 tendons coming out. And then we'll go to the deep layer, the flexor digitorum profundus with its 4 tendons, and you can see they're attaching to the dips, not the dips, excuse me, the distal phalanges. Whereas the flexor digitorum superficialis, its tendons attach onto the distal portion of the medial phalanges. So it won't flex the dips here, but it will flex the pips, the metacarpal phalangeal joints, and the wrist. All right, let's go on to the muscles of the posterior compartment. All right, we only have two layers there, a superficial layer and a deep layer. All right, so we'll see, all right, these muscles are going to attach onto the lateral epicondyle. All right, and we have our extensor carpi radialis brevis and longus. They do the exact same thing, except one's longer than the other. All right, so of course, looking at the name here, extensor carpi, they're going to extend the wrist and they're going to abduct the hand. Okay, that's going to bend the wrist towards the thumb side. Then we have extensor digitorum. All right, so this muscle is going to attach onto the distal phalanges, which means it's going to extend all the joints proximal to them. So it'll extend the wrist, it'll extend the metacarpal phalangeal joints, and it'll extend both the pip and dip joints. All right, also in the superficial layer, we'll see the extensor digiti minimi. I like the name of that muscle because it's cute. All right, digiti minimi has to do with the pinky. And so it attaches onto the distal phalanx of the pinky. So it's going to extend all of the joints proximal. So it extends the little finger. And then we have extensor carpi ulnaris. All right, and this muscle here is going to extend the wrist and adduct the hand because it attaches onto the lateral, excuse me, not lateral, the medial portion of your forearm, on the ulna side of your forearm. Then our deep layer, we've got extensor pollicis brevis, extensor pollicis longus, and then extensor indicis. All right, so extensor pollicis brevis is going to extend the metacarpal phalangeal joints of the thumb. Extensor pollicis longus, because of where it attaches, right, it's going to be distal to extensor pollicis brevis. It's also going to extend the metacarpal phalangeal joint, but in addition to that, it extends the interphalangeal joint. Then we got another muscle, extensor indicis, is in reference to your index finger. That's your second digit, right? And so it attaches distally on the, it attaches to the distal phalanx there. And so it's going to extend the metacarpal phalangeal joint, the proximal interphalangeal joint, and the distal interphalangeal joint. All right, let's just finish up with some of the muscles in the hand. And when we talk about the intrinsic muscles of the hand, we're going to see, all right, two major groups here, what we call the Thenar Group and the Hypothenar Group. The thenar eminence is that meaty portion right there at the base of your thumb. You can feel it. It's a fleshy portion. And then the hypothenar eminence is going to be on your pinky side, that kind of fleshy portion there on the medial portion of your palm, right by your pinky. So the Thenar Group, all right, is going to have the flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis. And again, the name tells you what it does. Flexor pollicis brevis flexes the thumb. Abductor pollicis brevis abducts the thumb. Opponens pollicis brevis is going to allow you to oppose the thumb, which means basically touch your pinky with your thumb. Hypothenar Group, same thing. Flexor digiti minimi, abductor digiti minimi, and opponens digiti minimi. This is all in reference to what those muscles do to the pinky finger. All right, mid-palmar group. Right, these muscles are deeper muscles in your hand. All right, and so you're going to see, all right, the mid-palmar group. These are the muscles that are found between the thenar and the hypothenar eminences there. So you have the lumbricals, the dorsal interossei, the palmar interossei, and the adductor pollicis. All right, the lumbricals, because of where they attach, they're going to flex the metacarpal phalangeal joint. But here's the thing, it flexes the metacarpal phalangeal joint, but it extends the proximal and distal interphalangeal joints of digits 2 through 5. The dorsal interossei, again, we're going to see a difference here. They're going to flex the metacarpal phalangeal joint, but they'll extend the proximal and the distal interphalangeal joints of digits 2 through 5, and we'll also see abduction. On our palmar interossei, they'll adduct the fingers. These guys do a couple different things. duck the fingers and flex the metacarpal phalangeal joint and extend the proximal interphalangeal joint and the distal interphalangeal joint. And of course, adductor pollicis adducts the thumb. Okay, so you can see over here by the thumb, here we're going to have our thenar muscles, and then over here by the pinky, we'll have our hypothenar muscles. And then in between, we'll have our lumbricals, our interossei muscles, and the adductor pollicis muscle. And then you can flip it over here looking at the palmar view here. All right, I'm going to stop here with the lecture, with the lab lecture material, and let's just do some labeling, and then we'll call it a night. So if you have your atlas with you, please pull out your atlas, and we'll quickly finish labeling the last of the muscles. We'll do the lower extremity. All right. Here we go. Some of these you've already labeled. Okay, so we saw this muscle before when we were talking about some of the muscles of the torso here. And so the psoas major muscle was that muscle that was just lateral to the lumbar spine. And so when we get down into the pelvic cavity, you'll see it just traveling inferiorly down towards your leg here, okay, the lower extremity. So here's the psoas major muscle. You'll see it on this model here. Psoas major muscle starts off here in the lumbar spine and it moves inferiorly down into the pelvic cavity towards your lower extremity. So the psoas major muscle is going to team up with another muscle, and it's going to create a new muscle. So here's the muscle that it teams up with, iliacus. Iliacus sits in the iliac fossa on the anterior surface of the ilium. And so you can see it here on this model, and then here it is on this model. And so what will happen is iliacus and psoas major are going to fuse together and form the iliopsoas muscle. This is the most powerful hip flexor muscle. What's hip flexion, you ask? Well, I'll tell you. If I say to you, okay, all right, you're laying on your back, and I say, all right, bring your knee up toward your chest. Okay, as you pull your knee up toward your chest, you are going to be flexing your hip, bringing your thigh closer towards your abdomen. And so iliopsoas muscle does that. Now, this, you don't need to know this, but this is called the inguinal ligament here. And so when we are inferior to the inguinal ligament, this is referred to as the iliopsoas muscle. All right. Going on to the posterior part in the gluteal region, all right, you can see the gluteus maximus muscle. All right, so the gluteus maximus muscle might be tough to kind of discern what that is. All right, that's pretty much all of this. That's the gluteus maximus. Gluteus telling you the region, that's the gluteal region. Maximus saying it's large, it's huge, big muscle. All right, here it is on this model. This is a lateral view here. Now you can see it on this model. This is a posterior view. If you're like me and you're sitting down, you're sitting right on your gluteus maximus muscle. All right, we'll get into the actions of all these muscles next class. All right, that's gluteus maximus. And here it is on this model here. All right, there's the gluteus maximus muscle. So it's all this. All right, now a little bit superior to the gluteus maximus muscle is gluteus medius muscle. Gluteus medius muscle is very similar to the deltoid in what it does. Like what the deltoid does to your glenohumeral joint, right? Your gluteus medius muscle, right, is going to have some similarities in the femoral acetabular joint or your hip joint there. Right, that's the gluteus medius muscle. And here it is on this model. Gluteus medius muscle helps to stabilize the pelvis. So if you're standing and we're talking and I say, okay, go ahead and lift up and stand on one leg, call it a stork stand. So just bring your right leg up and just balance on your left leg, right? Your gluteus medius muscle will engage on the right side. Or excuse me, on the left side. And it helps to keep your pelvis from dipping down. That's the gluteus medius muscle. Here it is on this model. It includes all of this. All right, that's the gluteus medius muscle. All right, right inferior to the gluteus medius muscle is called the piriformis muscle. This is an external hip rotator. It's this little fella right here. It's an important muscle because if you look closely at it, you'll notice something right below it, and that is the sciatic nerve. That's the longest, biggest nerve in your body. And so if the piriformis muscle ever becomes inflamed, there's a condition called piriformis syndrome. That muscle can go into spasm, becomes damaged, whatever. It will press on the sciatic nerve and cause sciatic-like symptoms. And in small population of people, the sciatic nerve will pierce right through that muscle, right? But in our model, it exits from the pelvis right below the muscle. Here you can see it on this other model here. So that is the piriformis muscle. Okay, so this isn't a muscle, right? You may have heard it referred to as the IT band, but we refer to it as the iliotibial tract, right? That's a dense connective tissue, right? That is found on the lateral portion of your thigh. That is called the iliotibial tract, and it's on the lateral portion of your thigh. And eventually, on the inferior portion down here, the iliotibial tract will fuse with the capsule of your knee. So sometimes people have knee problems, okay, and they've done x-rays and CT scans or MRIs, and like, we can't find anything wrong. We have no idea. There's a possibility that the iliotibial tract is involved. And this guy could be the cause, because I call this the coffee drinking muscle, the tensor fasciae latae muscle. All right, this muscle attaches onto the iliotibial tract right here. So if there's a malfunction with this muscle, it can cause some issues with the iliotibial tract, which can then cause knee problems. So this is the tensor fasciae latae muscle. And in case you're ever wondering, right, that's the type of coffee that I drink. I actually drink mochas, not a lot, trust me. But apparently I was told this weekend that mocha latte is not a real drink. I don't know, I'm not a barista. Okay, so now we're gonna look here back at the thigh. And in this model, all right, this is where we're looking at, right over here, right near the groin. So you can see here's iliopsoas muscle, and then you've got these three structures right here. I call that the femoral van. It stands for femoral vein, artery, and nerve. If we start on the medial side, blue is going to be a vein, all right, red is going to be an artery, and the yellow is going to be a nerve. So it's the femoral van, vein, artery, nerve. So pectineus muscle is going to be just medial to the van, to the femoral van. So you can see it's right here. That's pectineus. And then just inferior to that is adductor longus. Now again, the name of this muscle tells you what it does. It adducts the thigh. So if you're doing leg kicks out to the side, every time you bring your leg back down to stand on, that's called adduction. So this is adductor longus muscle. You have a brevis, but you don't need to know it for identification purposes here. Here you can see the adductor longus. If I go back to this slide, this is an anterior view. You can see this is an anterior view because we can see the front of your knee, the patella, a couple other things. All right, your foot is basically going forward here. All right, now we're looking at the medial view of your leg. How do I know? I can see the big toe. Big toe is medial. It's closest to us. All right, that's the adductor longus. Okay, it's anterior on the medial side of the thigh. Then we go all the way to the back. You have adductor magnus. Okay, magnus means large, big. So the adductor magnus muscle, I know you're dying to find out the actions of these muscles, but you'll have to wait till the next video, next class. And then in between adductor longus and adductor magnus is the gracilis muscle. All right, so this is adductor longus. This is adductor magnus. And gracilis is right in the middle there. Then you got this big, long, strap-like muscle. This is actually the longest muscle in the body. It's called sartorius. Whenever I say that, I think of the song that talks about Notorious. All right, but it attaches onto the anterior superior iliac spine here, and that's on the lateral portion there of your thigh, and it crosses over in front of your thigh, travels down on the inside of your leg, of your thigh, and attaches onto the medial portion of your knee. I'll show you a better picture here. So you can see, look how long that muscle is. It spans that entire length, runs across the front, crosses over the middle, and attaches down here onto the medial portion of your knee. That's sartorius, longest muscle in your body. So if you ever do the figure 4 position, all right, bend your knee or flex your knee, all right, and your hip and rotate your leg out, the figure 4, all right, the sartorius muscle is responsible for that. All right, so now we're going to talk about our quadriceps muscle. Quad meaning 4, there's going to be 4 muscles involved here. These are the muscles that are on the anterior portion of your thigh, that's on the front. All right, the most prominent anteriorly, that's the rectus femoris muscle. Okay, so this is a medial view. You can see it, and it's the most anterior muscle on the anterior aspect of your thigh. Same muscle, now we're looking at it from an anterior view. That's the rectus femoris muscle, right there directly in the middle. And then we'll rotate the leg one more time for the lateral view, and you can see the rectus femoris muscle here. All right, so this is the rectus femoris muscle. Get familiar with the views of these models and what you're looking at here. All right, now we're back to the medial view. And so we're seeing on the inside of your thigh, right, the vastus medialis muscle. All right, so on the medial view, this is the vastus medialis muscle. On the anterior view, there's the vastus medialis muscle. Now, I don't have a lateral view because you can't see it from our lateral view. So if you have a view, all right, there's the vastus medialis muscle. There's a difference. If you notice this slide and this slide, all right, what we've done is here's the rectus femoris muscle, right? Here it is. Now it's gone. Okay, that's the difference between these two views here. One has the rectus femoris, the other one doesn't. So if you're looking at this medial view and you don't label this vastus lateralis, okay, you cannot see the vastus lateralis from the medial view here. All right, speaking of vastus lateralis, back to our anterior view, here's the vastus lateralis. It's on the lateral portion of your thigh. Here, again, same muscle, we just removed the rectus femoris. Rectus femoris is gone, rectus femoris is back. So there's the vastus lateralis, and then we'll see the vastus lateralis from the lateral view here. It's going to be anterior to the iliotibial tract. Vastus lateralis. All right, and then our fourth muscle that's part of our quadriceps is the vastus intermedius. This muscle lies deep to the rectus femoris, so we have to take the rectus femoris away. That's vastus intermedius. All right, let's go on to the back side of your thigh, the hamstring muscles. There's three muscles that you have to know. The one that's most lateral is the biceps femoris. This is the most lateral. Then as we move medially, oh, you can see it here from the lateral view. There's the biceps femoris. Again, it's going to be posterior just behind the iliotibial tract. All right, then we have the semitendinosus muscle. Now again, it's tough to see here, but the semitendinosus muscle, part of it, the distal portion, sits on top of one of your other hamstring muscles. So I'm just trying to outline and delineate. Okay. That's the semitendinosus muscle. There's one arrow pointing to the distal portion of this muscle. Then kind of deeper to that, a little bit more medial to that, is going to be the semimembranosus muscle. So we have two arrows there. Okay, I'm just going to outline the semitendinosus muscle again. All right, so semimembranosus will be a little bit deeper to that. All right, those are hamstrings. Almost done. Now we're going down to the leg. A couple more muscles. All right, gastrocnemius muscle. This is that calf muscle that you see on most folks. All right, very well developed and athletes that do a lot of jumping. Okay, gastrocnemius, it's a two-joint crosser, crosses over the knee joint and the ankle joint. All right, it attaches onto the calcaneus, all right, with the help of the calcaneal tendon, also known as the Achilles tendon. Calcaneal tendon or the Achilles tendon. And then deep to the gastrocnemius muscle is the soleus muscle, named after the fish. There's a fish called sole. It's a flat fish. It's not bad to eat. Right. Jumping is going to affect the gastrocnemius more. Walking is going to be the soleus. I know, I agree. It does look like it would hurt to walk on. All right, so that's the soleus muscle. And the soleus muscle also attaches to the calcaneal or the Achilles tendon, and we give it a name called the triceps surae. I know, you'd be amazed, but that's the strongest. The Achilles tendon is the strongest tendon in the body. Biggest one too. Here is the soleus muscle. All right, that you can see it's deeper. Here's the gastrocnemius muscles up here. And soleus is all of this. All right, on the lateral part of the leg, right? Because you have three compartments in the leg. You've got an anterior, posterior, and lateral compartment. You have two muscles. All right, you've got the fibularis longus muscle, or you can call it peroneus longus. That's going to be the more superficial muscle in the lateral compartment. So that's going to be here. Here's the tendon. You can see it a little bit. All right, that's going to be fibularis longus or peroneus longus. And then the brevis is going to be closer to the ankle joint. So you'll notice the arrow will drop down. Boom. And it's also here. Okay, so fibularis brevis or peroneus brevis muscle is going to be closer to the ankle joint. All right, then the anterior compartment here, we have tibialis anterior or anterior tibialis muscle. This is one of the muscles that likes to give you shin splints. All right, sits right next to your shin there, the flat portion of the tibia, tibialis anterior. Then if we look onto the posterior portion, all right, we've dissected away soleus and gastrocnemius. Deeper down, we have our posterior tibialis or tibialis posterior. Oh yeah, which one do you need me to go back to? Hold on.
Could you go back to the Lateral view of the lower limb.
How about this one here
Yes, thank you.
or this one? Yeah, fibularis brevis, peroneus brevis. There's a, I don't know, I always think of Peroni, which is an Italian beer for this muscle. I don't know why. And then there's the longest muscle.
Thank you.
You're very welcome. Okay, so there's tibialis posterior, posterior tibialis on the back side. Then also on the back side, but on the medial portion, you've got flexor digitorum longus. This muscle is deep to soleus. This is soleus right here. And then you've got your flexor digitorum longus. And again, this muscle tells you exactly what it's doing. It's going to flex the toes. Well, what is flexion of the toes? Curling your toes. Okay. If you're sitting down and you have your bare feet and you're on carpet and you just start to curl your toes, you're utilizing flexor digitorum longus. And then on the front, on the anterior compartment, you have extensor digitorum longus. So this muscle will extend, raise the toes up towards the ceiling there. And look, if you look closer, you'll see. Remember in the wrist we were talking about the flexor and extensor retinaculum. Well, down in your foot you have an extensor retinaculum here, right around your ankle. Because if you didn't have that extensor retinaculum, right, those tendons would come away from the bone. And then finally, we got our patellar ligament, also known as the quadriceps tendon. Now you can use either or. Okay, technically, if the arrow's pointing in between the tibial tuberosity here and the patella, right, that's bone to bone, that's going to be a ligament. Patellar ligament. But remember, the patella is a sesamoid bone. Sesamoid bone, all right, sits in a tendon there. Okay, so either or is acceptable. I'm not going to split hairs. All right, so patellar ligament, or you can call it the quadriceps tendon. And that's it, folks. That's all. So